Hello, everyone, and welcome to this session of the Community Table. Today, we have Andrea Russell from our local Veterans Affairs Department here in Louisville, and she's going to talk to us about serving homeless veterans. Please feel free to use the chat if you would like to ask any questions during the presentation. Andrea, the floor is yours.
Thank you, Ashley. Hello, everyone. My name is Andrea Russell. I am a licensed clinical social worker working for the Robley Rex VA here in Louisville. So I'll talk to you. I'm in their Healthcare for the Homeless Veterans program. So I'll talk to you today about homeless services for our veterans. So if you encounter any, you know how to reach out for support for them. VA Homeless Program's mission, our goal is a systemic end to homelessness, which means there is no veterans who are sleeping on our streets, and every veteran has access to permanent housing. So our goal to end homelessness means that every community across the country has identified all veterans who are experiencing homelessness. I just finished a meeting that we call Coordinated Entry. We work with Volunteers of America's SSVF programs and other community partners to talk about anybody who is a veteran who is experiencing homelessness. And so we can provide them with the best support that they can get. We're able to provide shelter immediately. That doesn't always mean, so the shelter can look different depending on where the veteran is. So we have shelters that participate with us, and we have programs that work with the veterans. We provide service-intensive transitional housing in limited instances, have the capacity to help veterans swiftly move into permanent housing, have resources, plans, and systems in place should any veteran become homeless or be at risk of homelessness in the future. So I'll address each one of those to talk about what that looks like. And then the timeline for individuals who are at risk of homelessness, that's about a 30-day window. A lot of people, are behind on rent, may get an eviction notice, and then want to address that immediately. While they may be at some risk of possible homelessness, it's not imminent at that point. Imminent risk is they've already received an eviction notice if they're housed. They're going to be homeless within 30 days. If they're not, I refer them to other resources to assist them in the interim. The federal definition of homelessness is outlined under the federal McKinney-Vento Homeless Act. It's an individual or family without a full-time or adequate nighttime residence. An individual or family with a full-time nighttime residence that is not intended to be a regular place for people to sleep, including a park, a car, abandoned building, bus or train station, or a campground. I'm sorry, somebody's trying to message me. An individual or family living in a shelter, including a hotel or motel, designated as a temporary living arrangement. An individual residing in a place, not meant for habitation. So what that looks like is if a person is living with a family member, a friend, renting a room from somebody, they are not considered to be homeless. They are considered to be doubled up. If they're renting a room, they're considered to be housed because they are paying rent at that location. So many of the people that reach out say, I'm living with my mom, I'm living with a friend, I'm sleeping on my kid's floor. Under the guidelines, they're actually not considered to be homeless. So we would refer them to other means to be able, other resources to assist them. So when the definition says have capacity to swiftly move into housing, multiple factors can be speed bumps into housing. Documentation is a huge one. Housing and legal history, housing stock, voucher availability, staffing capacity, and the veteran actually prioritizing their housing. So what those, obviously, if they don't have ID, Social Security card, a big factor is documentation for children. Many people don't have appropriate documentation for their children. Section 8 will not approve an individual for housing if they don't have their child's birth certificate and Social Security card. So that's a big one. Voucher availability can be factors at different periods of time depending on the situation. We work around staffing capacity, so but we have had issues with community partners who have short staff that are not able to assist the veteran in a short amount of time. And then the veteran prioritizing their housing. So are they saving money if they're required to pay a portion of their housing costs, which is 30%? Are they acting swiftly to get their identification, their social security card, meeting with their case manager, meeting with their VA representative to make sure that they are prioritizing their housing? So VHA healthcare markets in Kentucky are listed on this map. I get a lot of calls from individuals who are in different catchment areas. They think that there's just one central location where they could get assistance. Obviously, Louisville is a huge market. We probably have the most resources in the state. However, if an individual is in a different catchment than the one that Louisville falls under, I'd like to refer them back to their catchment area for best supports. They're going to be able to talk to them, especially if they're needing shelter placement. Most folks are not going to travel 3 hours across the state, or maybe doesn't even have the resources to travel 3 hours across the state to get into one of our shelter programs or come to Grant Per Diem, or they want to be housed in the area that they have been living. So we want to refer them back to the appropriate catchment. I'm going to share these slides with Ashley so that she can share them with you all, but the numbers are associated for the different catchment areas. Homeless team services include intake and outreach. So I work with the outreach team, transitional housing, grant and per diem, and contract. Grant and per diem and contract, and we'll go into that a little bit more, are the placements for the transitional housing. So the names are different because of the way they're set up and that they're funded and the way that the contracts are written, but they act similarly. Permanent housing planning, which may include HUD-VASH. Sometimes those are referrals to SSVF. Sometimes they are referrals to senior housing or other appropriate housing supports. We have a community employment coordinator. She works with veterans to help them find employment. So if a veteran says to me, I'm homeless because I can't keep permanent employment, I'm going to refer them to our employment specialist. We have a lot of employers that reach out to her that are actively seeking veterans to hire. So those are good fits for those folks. And then we have a veterans justice outreach team. They work with individuals who are experiencing incarceration. So the function of intake and outreach, we have what's called the NCCHV. It's a national hotline. I'll share that number with you all. So the national hotline takes calls in from people from all over. They route it to the catchment area that's closest to where they are, and then somebody returns their call within 24 hours. I'm the primary person for the hotline calls for this area, but if I'm out, there's other people that answer those calls as well, and then we make the appropriate referrals based upon the information that we receive. We have somebody that works hospitals and institutions in reach. So she's going to be working with anybody that shows up at our hospital who is homeless. She's going to go to recovery programs. We have a lot of recovery programs in the area that reach out to say they have homeless veterans there. So she's going to be the person that's going to work with them. And then we have street and community outreach. We have somebody that's at St. John's Center 3 days a week here in Louisville. It's a day center. She goes to encampments. She will work with Southern Indiana and their homeless coalition. And she also does some rural outreach. So she works with individuals who may not be in facilities. They may be sleeping out long-term. They may not want to go into shelters for various reasons. She's going to work with those individuals for case management and appropriate referrals. So the number that we want to make sure everybody has access to is this 877-AID for VET. That's our national call center for homeless veterans, 877-424-3838. a person can call from anywhere in the country, and they will be, they will talk to them. If they're in crisis, they'll refer them to our crisis hotline, which is still the same 988 number that everybody else uses, or 998 number. Um, but they will also refer them back to us. And then there's a blurb about what's going on with that individual. So I like to do my research before I call them back. I figure out, is this an urgent call? Is this somebody who just needs resources because they're behind on their rent? Is this a person that I need to call and make sure that I have appropriate information so they can get them into shelter today? And do they have a chart with us? So we want to make sure that they have a chart with the VA, and I'll talk a little bit more about that as well. Homeless prevention services. So the calls from the hotline, I already said, are often from individuals who are not currently homeless and or not facing risk of eviction. That's fine for them to call that number. We just won't be able to assist them with homeless services. So that's going to be a referral. I try to make sure that I give every person a referral or information on resources that fits their immediate need. Those calls can also be redirected to our social work services staff. So if the person is VHA eligible, which means they're healthcare eligible, I'm going to refer them back to the social worker that works in their clinic that's closest to them, the one that they see all the time. And they're going to be referred back for more resources in their area for rent and mortgage assistance, eviction prevention, utility assistance, monetary assistance, and then senior and disabled housing programs. So veteran eligibility and homeless services. Significantly, veterans can be eligible for HCHV services even if they are not healthcare eligible. So a lot of individuals who have been in military do not believe, and they know that they're not eligible for healthcare. They've upgraded the terms and conditions on who we can support as of 2015. So individuals can be labeled as humanitarian. So what humanitarian means is that if they served less than 2 years or had a discharge that is other than honorable, they can still be served through our homeless programs. So I encourage every person to reach out to our eligibility office. I have a lot of veterans that say, no, I'm other than honorable. I don't qualify for services, but I don't know what else to do. Just because they're other than honorable does not mean they don't qualify for homeless services. So we're going to connect them with our eligibility and enrollment office. We're going to check to make sure that they're eligible for homeless services, and then we're going to work with them appropriately. Also, an individual who served in the National Guard or reserves but was not activated under Title 10 or Title 38 is not eligible for homeless services regardless of the time that they served. So what that means is, if an individual was reservist, National Guard, and didn't get deployed, they are not eligible for homeless services. They don't qualify for healthcare services. They also don't qualify for homeless services, which is another reason why I like to refer individuals to eligibility to be vetted to make sure that they're eligible. We've had people that we thought were eligible. We had worked with them in the past, and it was not detected. And now we've tried to work with them again, and eligibility says this person's not eligible for services. So we don't want to any person to start the process thinking they're going to be working with the VA on housing and then have to come back and say, sorry, you're not eligible for services. So we like to make sure that we get all that information done up front. So homeless service limitations. The aging population is a huge population that we're seeing now, who are in need of services. And normally those folks that are about 60 and older. Sometimes we see some with some healthcare issues that are, or about 70 and older, but sometimes folks with healthcare issues with 60 and older, we're seeing that they are in more need of services, have less family support, maybe don't know how to use the computer. So even if were to make um, referrals for them to have certain resources available, they often are not able to access those services because they have to go online and apply, or they have to do something that requires them to be computer savvy. So veterans must be able to live independently to work with our programs, and all of the VMAC have geriatrics and extended care services. So those are GEC services. So if an individual is going to go into one of our grant and per diem programs or be referred to HUD-VASH for housing, they have to be able to complete their ADLs and their IDLs. So we want to make sure that those things are taken care of, because there's nobody that's going to be living in the home with them. Now, if they have a caregiver that's going to be living in the home with them, we can cross that bridge. VA also has like personal care homes, and it's also limited to severely mentally ill individuals who are not engaged in treatment. We do have folks who suffer from severe mental illness that are housed. However, they need to be able to live have a certain level of independence to be able to do that. Veterans on the sex offender registry cannot be served by our homeless program because they cannot get a Section 8 voucher. So we can't refer them to VASH. None of the shelters in Louisville will allow sex offenders who are on the registry to reside on their property. So we cannot refer them to transitional. So the unfortunate problem that we continue to see with sex offenders is that they're limited to either their own independent housing or boarding programs. So we do a lot of referrals to boarding programs. SSVF will work with individuals who are on the sex offender registry, and they have had some success housing them here in Louisville. And those are usually congregate housing settings. So they just need to be aware of that. Intake and case management services. All veterans seeking services from homeless programs, including the use of VA transitional shelter, need to complete an intake and assessment. So we, one of the outreach team members will meet with them, complete an intake that takes about an hour and a half. It has housing history, family of origin, their military history. We include mental health, physical health, screenings on trauma, substance use, and then there's also a system that is called HOMES. It's our housing information system that's used by the VA, and so we put information in there, and we can also see a history of any homeless services that the veterans ever use. So if I look in our electronic health record system and can't find a veteran, then I would look at HOMES to see if they have used homeless services somewhere else in the country. It's really good to help us to track individuals, but also to be able to show chronicity. And so we make sure that we prioritize them and their housing needs. We have outreach case management services to homeless veterans not in VA transitional housing programs who need assistance connecting with resources and permanent housing planning. Lots and lots of folks say, I don't want to live in a shelter. I can't stay in a shelter. They want to continue to sleep outside, and that's absolutely acceptable, and we will still work with them on housing. Outreach case management services to veterans living unsheltered who decline housing options but need ongoing engagement, rapport, and relationship building and assistance with connecting to services, including referrals to housing, are accepted. Transitional housing is grant and per diem and contract beds. There are rules and requirements that veterans must participate in. We try to make sure that we talk to them about the fact that it is a program. GPD and contract beds are programs. They're not emergency housing. So they, like I said before, they must be able to complete their ADLs for independent living. They must agree to the terms of the transitional housing program. So we partner with outside agencies. They have, some things specific to the site placement that they have to agree to, but also the GPD model and the contract model program. So the models are service intensive, low demand, bridge. So bridge means that they're going to have housing in 90 days. If that, and securing housing in 90 days is not always an option, especially if they don't have all of their documents or there's some issues that we are aware of. But if we know they're going to have housing in 90 days, we can do bridge housing. That usually means they already have a voucher in hand. Low demand is there's no expectation of clinical treatment. So if somebody has said that they do not want to participate in clinical treatment, or they've not necessarily been successful at clinical treatment for whatever reason, they can participate in a low demand program. They do not have to contract for sobriety. They do have to commit to not using on site, not showing up intoxicated or under the influence of substances, but they do not have to contract for sobriety. And then there's a hospital to housing program. So if they're in our Roadley Rex VMAC, they can come from there to a transitional bed pending their housing. Those folks are usually a short-term transition too, but there's a hospital housing program. And then obviously clinical treatment, which is going to have they have to contract to work on their recovery program, whatever that looks like for them. That's usually about 6 months. And they normally do not work on housing during the time that they're working on clinical treatment for at least about the first 4 months. The other programs, they work on housing pretty immediately. The goals of grant and per diem and contract programs is that the veteran moves into permanent housing. The veteran must be able to live independently. The veteran is to increase their income and save money. Income can be from employment or benefits. The expectation is saving at least 30% of the income and or paying down debt. So the 30% is because all housing programs are going to have the expectation that the individual pays 30% of their income towards rent. That's going to be Section 8, that's going to be senior, affordable senior housing or income-based senior housing. So we want to make sure that we start to work with that individual on saving that 30% because that's going to be the expectation moving forward. So in permanent housing, appropriate permanent housing plan and referrals based on the veteran's history of homelessness, especially chronicity of homelessness, veteran case management needs, motivation to engage in ongoing case management. So if we're referring somebody to VASH, VASH is always with case management. So HUD-VASH always comes with case management. If that individual does not have case management needs, we don't feel like that they have case management needs, they're not expressing that they are interested in case management, we will not refer them to VASH. The veteran's age and disability as well, eligibility for senior or disabled housing. And so we look at if they're over 62 and or 55 and older, but disabled, they can be eligible for senior and disabled housing. We may make referrals for that. Veteran income, eligibility for referral for HUD-VASH and or Section 8, barriers to housing, and barriers to housing could look like lots of evictions. There can be several factors that include that factor into barriers. And then partner in collaboration with VOA, SSVF, as I've mentioned before, for alternative permanent housing and planning options. Veterans do need to have documentation. They don't have to have documentation coming into our programs. We know that a lot of folks, especially those experiencing homelessness, don't have all of their documentation. We will work with them on that. Veterans cannot have active bench warrants. We are going to work with that individual. They can go into GPD with a bench warrant. They cannot be referred to housing with the bench warrant because if we refer somebody with an active bench warrant, they get into housing, they get arrested, and they're gone for, 3 to 6 months, they're going to lose their housing. They're going to lose their housing. They're going to lose their voucher. So then we have to start over with them anyway. So we just want them to clear up those warrants so that they're not at risk of losing housing. Veterans need to be capable of independent living. Again, ADLs, IDLs. Veterans need to be agreeable to planning for 1 year of stable housing due to requirement of lease signing. Sometimes we get individuals who say, well, I want to get housing, but then I want to move to another state. They need to at least be in the state that they're in or in the location that they're in for 1 year prior to trying to move to another location. The HUD-VASH program is combined with a Section 8 voucher and ongoing supportive case management. The voucher is assigned to the veteran, but can include veteran identified family members. So what that means is it doesn't have to be a spouse and children. It could be a supportive person that they want to live with them. It can be a significant other. It can be a parent even, or an adult child. So they can identify the family members in which they want to be on their voucher. VMAX have either tenant-based vouchers, site-based vouchers, or both, depending on the housing market in that area. They must meet income eligibility guidelines for Section 8, as well as not being on the sex offender registry or have felony methamphetamine manufacturing convictions. That is a Section 8 requirement. And the eligibility guidelines financially, they have changed recently. Some programs are still doing, I think it was 40% AMI on the poverty guidelines. Now we will take somebody at 80%. So for an individual, they can earn up to $47,500 and still qualify for HUD-VASH. Veterans must have case management needs and be willing to participate in case management. Housing First is an evidence-based practice and is mandated for HUD-VASH per the national policy. So, an individual does not have to participate. Housing First says an individual doesn't have to participate in treatment or mental health care prior to moving into their housing. So we also will refer somebody to HUD-VASH, even if they say, I don't want to go into treatment. I don't want to be in recovery right now. That's not my focus. My focus is housing. We will still work with that individual to get them in. So Veterans Justice Outreach Veterans Justice Outreach works with veterans in local jails in order to assess eligibility and enrollment status. They link veterans to care and or assist them with legal proceedings by communicating treatment information to legal partners with a secured ROI. The court intercepts meet with the veterans and legal partners at court proceedings to assist them with disposition planning and or to communicate treatment information. They have case management. They connect the vets to needed resources such as primary care, mental health, Robley Rex VMAC, act as a liaison between Robley Rex and the court systems. And then they provide education. VJLs conduct and facilitate trainings for local community partners, including police, attorneys, and other entities on veteran-related issues, including TBI, PTSD, suicide prevention, et cetera. So we get referrals for housing from our VJOs, individuals who may be exiting and trying to re-enter society, but know that they don't have housing placements. They will work as a liaison to connect them with homeless services. They also work with that veteran to make sure that their needs are met while they're incarcerated. So they're a good resource to have. Veterans Benefits Administration is VBA. They work with individuals for pension. VA's pension program provides monthly benefit payments to certain wartime veterans with financial need and their survivors. I will say many people are not aware that The pension is, so we have two forms of pension. There's a service-connected pension, which means that individual, something happened to them while they were active duty that caused them to have lifetime issues, medical issues. And so they can be compensated financially based on a service connection. They also have what's called a non-service connected pension, and lots of folks are not familiar with non-service connected. So non-service connected means um, the individual didn't have any issues while they were in the military, so it's not connected to their time in service. However, they have medical conditions now that prevent them from having gainful employment. So those individuals to get non-service connected pension, like is in the slide, they have to be a wartime. So are they Vietnam era, Persian Gulf? One of the wartime era people can get a non-service connected pension. If they're getting Social Security, there's a cap on that. So they kind of want to weigh out whether Social Security is going to give them more or whether they're going to get more with their non-service connected pension. And individuals can get service connected as well as Social Security at the same time. So we often see people who may be 100% service connected and collecting Social Security. So they are bringing in upwards of $4,000 per month without employment. So that's a good resource for anybody to apply for. Disability compensation is they oversee the delivery of disability compensation. It's tax-free. And it's paid to veterans with disabilities that are a result of disease or injury incurred or aggravated during active military service. That's going to be their service connection. Veteran service organizations. So Kentucky Department of Veterans Affairs, we call it KDVA. Their mission is to work to make sure that Kentucky's 295,000 veterans and their families receive all the benefits and services that they've earned. They have benefits counseling, skilled and long care at the state veteran centers, dignified interment at state veteran cemeteries, healthcare, education, employment, special programs for veterans, homeless veterans, and others. So they have financial programs that will assist individuals. They also have housing across the state. Unfortunately, what we found is that many of the long-term facilities are very expensive and our folks can't afford them. So we have, I looked at one of the programs for one of our senior veterans and it was $5,000 a month. So they're pretty expensive. So a lot of folks cannot access those programs, but they are available, and we work with individuals to try to get aid and attendance. So there's a program called Aid and Attendance that you can get in addition to your service connected or non-service connected that will assist you if you can't afford some of those senior programs. So the Office of Geriatrics and Extended Care Staff lead efforts to provide programs and services in a range of healthcare settings. So they have acute care, home care, extended care, purchased home care, hospice and palliative care, and community and facility-based care. So what that looks like is if I talk to somebody who is a senior and may not be eligible for one of our transitional programs or to be referred to HUD-VASH, I may refer them back to GEC so that they can get an assessment with them and be referred to a program that's going to fit their needs. If somebody's bedbound, they're not going to be a good candidate for VASH. We're going to refer them back to GEC so they can get them into the programs that best fit their needs. All sites have veterans care coordinators specific to LGBTQ plus care. Looks like she put a link in here. So they have mental health services, including psychosocial assessments for hormone therapy and gender confirming surgeries, hormone therapy, gender affirming prosthetics, testing, counseling, and care for HIV and sexually transmitted infections, including PEP, post-exposure prophylaxis, and PrEP, which is pre-exposure prophylaxis for veterans at risk of HIV. And they have other prevention, screening, and wellness and testing services. So I am a fast talker. I ran through the slides much faster than I thought I would. Thank you for attending this presentation, and I am open for questions and or comments. Greer has her hand up. Ashley.
I just gave Greer the capability to talk.
Hi, can you hear me?
I can hear you.
Hi, thanks. So I work at St. Vincent de Paul, and we have a VA GPD program, and you really piqued my interest when you said that you have a coordinated entry meeting, I think monthly, because I thought that the by name VA coordination meetings were dead. So could we jump in on those some way?
I am so glad you said that, Greer. So we have recently talked about expanding who participates in our coordinated entry meetings. I will definitely talk to Coletta about your interest. I don't think St. Vincent de Paul is being represented at this time. So the case manager is no longer with that program. And historically, they've only had the case manager and the GPD liaisons involved in that. But I would definitely let Coletta know you're interested. I think that would be great.
Thanks. Have you had other VA GPD groups included, not just SSVF?
We have the case managers for each site and the liaisons. So if there's a turnover in case management, or if that individual is not able to participate, it doesn't go as well. I think having some other representation there would be really helpful.
And is the common assessment team participating in those currently?
They are not. So that was another suggestion that I made last week. No, we participate in meetings with them. Lori actually participates in the outreach meeting that they have on Monday morning, like the encampment meeting. But I think it would be better if we had somebody for common assessment to sit in on our coordinated entry also.
Yeah, we'd love that. Let me drop my email in the chat just in case you need that.
Absolutely. Thank you.
Thank you.
Don't know if anyone else has any questions yet, but I just wanted to say I had no idea that there was this humanitarian veteran status that existed, because I have encountered people who were in that situation, and I didn't even know that existed.
Sure.
So is there, I know like people who are discharged honorably, they get like a DD 214. Is there something similar to that for people that would qualify for this? Like, how would they prove that status?
So I can actually look up, well, I have our PSA look up anybody who reaches out and says, you know, hey, I'm a veteran, I need assistance. So we can run what's called, we call it a VDIR. It gives us an explanation of their time in service. I always refer to eligibility just because they're difficult to read. And sometimes you can look at them, and even though they were in the reserves, it looks as if they were active. So I just don't want to give anybody false hope. I can give out the number to eligibility there. Anyone can go to Robley Rex VA, and they can, it's 800 Zorn Avenue, or any VA that's in their area. They can ask for eligibility and enrollment, and they will meet with those people face to face. There's also a number, it's called VA Health Eligibility Center. It is 877-222-8387. And actually, I don't know if you can put that in the chat or if you want to just share it. So that's a national number. Anybody can call that number. I will say it is more difficult for folks who are humanitarian to get a chart created. I've seen it happen, but it just depends on who you get at that national number. If you're local, they will want to see an ID. They'll want you to bring your ID with you. So if you're struggling and you don't have an ID, but we can work to get that eligibility cleaned up through other methods. It just takes a lot longer. I mean, sometimes it can be a few weeks before we can get that hammered out. So we just like to go the shortest route, especially if somebody's sleeping out and they're really seeking support.
And do they qualify for all of the other services that veterans do if they are granted the status?
They do not.
Okay.
They do not. So healthcare is emergency. So if somebody shows up at the hospital, even if, you know, I showed up at the hospital not being a veteran and I'm in an emergency status, they will still see you. They'll just refer you out to other folks. But some individuals are able to get emergency psychiatric services on site and ongoing to manage whatever crisis situation they're in, but they're not going to be eligible for healthcare benefits.
Thanks for explaining that.
Not a problem.
Any other questions?
Did Greer raise her hand again, or is it still up?
No, I raised my hand again. I'm wondering, could you talk a little bit about how Robley Rex is building a new site on the East End and what that transition is going to look like? I haven't heard much about that.
They are building a new site. We are not 100% sure what the transition is going to look like. It's supposed to be done next year. I know there were some building issues with the blasting recently. I have not heard that slowed down the process any. It just changed the way it looks. So most of the things are outpatient services. So that's going to be all of the hospital staff and some of the major services are going to move over to the new site. We are hoping. So I'm actually housed at the old Shavley location, which unfortunately is not open to veterans, which is kind of sad because we have lots of people that say, I want to come and see you face to face. Well, we're not open to veterans. Most folks have moved to Greenwood. We have not moved to Greenwood. And we're not sure if we're going to have space at the hospital at the old hospital when the new hospital opens. So there's still a lot of gray areas there, Greer, but we're hoping to get some more information in the next few months. I hope that helped. I know I didn't answer your question specifically, but it is going to be a bigger hospital that's going to be more accessible. And it's accessible by bus line. So that's a good thing for our veterans who may not have transportation. I will say also, I didn't bring this up. It's a new feature. We have the ability to do ride share for veterans. It is very specific, and there has to be some things that allow us to set up a ride share. But if there's a veteran who says, I'm on the other side of town, I have no transportation to get to you all, I can schedule them with the ride share. As long as they have a smartphone and they can receive text messages, I can schedule a ride share. Now the ride's only going to pick them up from where they are and take them to exactly where I say they need to go. It has to be aligned with services that we're going to provide. We have to be working with them. Even if I'm going to schedule them for, let's say they're going into emergency shelter, but they're like, I can't even get to the shelter. I will set up a ride share contingent upon them working with homeless services moving forward. I'll schedule them a ride to do their intake assessment appointments. I had a veteran who his eligibility it was sketchy. We weren't sure. It said he was ineligible. I thought he should be humanitarian. So I scheduled him a ride share to go to the hospital to clear that up so that we could then work with him. So we do have the ability to do some ride shares. So even if they don't have transportation, please tell them, to let us know that so we can work with them.
Would that just be here in Louisville, or do other catchments offer that you know of?
Other catchments do offer it. It's not in all catchments. And we were actually the last location in this area to do ride share, which surprises me because we're a pretty big area. That we set up rides daily. So I'm the point of contact for the homeless teams, ride shares. And for the most part, it goes very, very well. Now they're not going to get out of the car and go get the person. So the person's kind of got to be ready to go. There is limited assistance. So if they have some mobility issues, there's just limited assistance. These are contract workers. So it's not like they work for the VA, it's Uber and Lyft. But for the most part, it's gone well. I've only heard of 1 or 2 instances that there were issues. And I could see the chat. I don't know if people have put questions in there. I mean, I can't see it. I can see those numbers.
No,
No,
it
okay,
doesn't
good.
look like there are any recent questions. So I am fine to give everyone the gift of time. So I just want to say, oh, wait, Laura raised her hand. Let me enable you to talk. There you go.
Hi, sorry, I didn't know you couldn't see the chat. I just added that I work at St. John Centers, and that continuum of care meeting that you have that may or may not open up to outside agencies, we would probably definitely be interested, so we could help connect anyone to services that we don't know about.
Sure, absolutely. That is next. As soon as I finish this, I'm going to reach out to my supervisor to talk about that. I'm glad people have an interest. I have, now we're doing a more by name list. So originally it was just kind of a little bit of talking, and we took some notes and we moved on. So now we have this full on spreadsheet, and we're going to update people over the weeks to figure out where they are in the housing process. I was on the meeting right before this, and I think there were at least 5 people who recently moved in and or were slated to move into their apartments in a couple of days. So that's always a good thing when we can see some progress with the folks that we're talking about and make sure they're receiving services. So Laura, I will definitely follow up with you all.
Awesome.
More than likely, Lori will reach out to you and let you know.
Thank you.
No problem. Thank you. And actually, I'll send you my PowerPoint so you can share those numbers and then the catchment map. If anybody has any questions, they can reach out to me directly. My email is andrea.russell@va.gov. And I am the entry coordinator for the homeless program. So I talk to or communicate with my coworkers on just about every person that comes through our program.
All right. Well, if no one has anything else, I just want to say thank you, Andrea, for your time. Thank you to our partner, Anthem Medicaid, for making this series possible. And thank you to everyone who came today. Our next session is scheduled for December 21st, and we hope to see you all there. Thank you, everyone.
Thank you.